My name is Pia Guanicol Rocolas from Davao Doctors College from Group 1612D. So I'm going to perform the procedures in parenteral medication. So a parenteral medication is administered through different routes other than digestive tract. This may be done through intradermal, intramuscular, and subcutaneous injections. So for this video, I am going to perform 3 skills, which will be divided into 3 scenarios. First is an intradermal injection, followed by subcutaneous injection, and lastly, for intramuscular injection. So in performing the preparation phase of these 3 skills are the same. I am going to perform it once to save time and energy, and followed by administering the medication to the patient. So now, prior to performing the procedure, check first the doctor's order to ensure that the patient receives the right medication at the right time by the proper route. So make sure to know why the client is receiving the medication. Okay? So as for the doctor's order, sterile water for intradermal 0.1 ml, vitamin K for intramuscular 0.5 ml, and Livener for subcutaneous 0.1 ml. Now after that, check the medication administration record, which is known as the MAR, to determine the time, dosage, and type of medication that was last taken by the patient. Okay. Check the label on the medication carefully against the AMAR to make sure that the correct medication is being prepared. Okay. This is the sterile water, and this is the Livener. And also this is for the intramuscular vitamin K. Now remember to follow the 3 checks for administering medications. We need to read the label on the medication when it is taken from the cart, before withdrawing the medication, and after withdrawing the medication. This is done to systematically verify and ensure the accuracy of medication selection and dosage, thereby minimizing the risk of errors and prioritizing patient safety. Now organize the equipment to save time and reduce the chance of error. So the equipments that I have here are alcohol pads, the syringes, the aspirating needle, the alcohol, the ball pen for the documentation, and the clean gloves. Now in preparing the medications from the vial, first we need to do is to perform hand hygiene. This is to deter the spread of microorganisms. Next is to read again the label of the medication before withdrawing the medication. Okay. So this is sterile water 0.1 ml. And now, mix the solution by rotating between the palms of the hands. Avoid shaking it as it may foam the vial. So we need to avoid that. Okay? And then I'm going to clean the rubber cup with antiseptic wipe by rubbing it in a circular manner to reduce the number of microorganisms. Okay? So in a circular manner, then dispose. Okay. Before withdrawing the syringe to the vial, remove this needle to attach the aspirating needle to make sure that the needle is attach the needle filter and make sure that the needle is firmly attached to the syringe, because using the filter needle or the aspirating needle prevents any solid parts from being drawn up through the needle. Okay? So I'm just going to get this 1 cc by opening it. Okay. Okay. Disattach the regular needle, and then open this aspirating needle. Then attach this aspirating needle to this 1 cc injection. Then after that, we're going to remove the cup of the needle. Then draw up the syringe. Into the syringe of the amount of the air equal to the volume of medication to be drawn. So I'm going to open like this to avoid breaking. Okay, so I'm just going to draw up an exact amount of air, which is 0.1 ml for the sterile water for intradermal injection. So make sure to do a bevel up and then draw the air, and then invert the vial like this, and then draw the exact amount of sterile water, which is 0.1 ml. Okay, I'm going to get this, and then I'm going to recap this like this one to avoid pricking our fingers, and lock like this one. Then I'm going to get the filter needle or the aspirating needle, and then attach this one to the regular needle. Okay. Okay, so done. Now I'm going to write again the label of the medication and place it to the medicine tray. Okay, so here's the medicine tray that I'm going to bring with me when I'm going to the room of my patient. So I'm preparing the medication from the ampules. So perform again the hand hygiene to deter the spread of microorganisms, and again read the label of the medication before withdrawing to ensure accuracy and the right medication. Okay, so this is the vitamin K. Okay. So I'm going to after that, we need to flick the upper stem of the ampule several times with a fingernail in order to bring all the medication down to the main portion of the ampule. Okay, so I'm just, as you can see, I'm just flickering the upper head of the ampule for a while. Okay, now since all the medication has been down on the ampule, in order to break this, I'm going to place an antiseptic wipe around the ampule neck and break off the top of the head, and by bending towards you to ensure the ampule is broken away from yourself and away from others. Okay, now so it is important to use an antiseptic wipe to break the ampule to protect the fingers from the broken glass. So I'm just going to clean this one. Okay, now I'm going to break by. Okay, now I'm going to dispose this one. Okay, so as you can see, I've already opened the ampule, and next by doing this, I'm going to get a 3cc syringe and open this one. So now we need to withdraw the medication. So first, place the ampule on a flat surface, then attach the filter needle to the syringe to prevent glass particles from being withdrawn to the medication, and remove again this cap. Okay, so I'm going to attach the aspirating needle by opening this one. Okay, so firmly attach this aspirating needle, then open like this one to avoid pricking. Then I'm going to and remove this cup and insert it to the center of the ampule with the needle tip or shaft to keep it sterile. Okay, so I'm just going to do like this one. I'm going to withdraw an exact amount of medication, so for a while. Okay, okay, now I'm going to withdraw an exact amount of okay, so since it is easy for me to get the medication, so we make sure to do a bevel down to get all the medication, and then do like this one to get all the medication, because this was being taught by my last clinical instructor. So okay, now I'm going to dispose the ampule, and then I'm going to get all the bubbles, okay, to the medication. So to avoid any bubbles from getting into our patient. So I'm going to recap this one, like doing this to avoid our finger to be pricked and locked. And then attach the aspirating needle and attach it to the regular needle. As you can see, here is the medication. So just going to attach this one and put it to our prepared tray. Okay, now I'm going to withdraw the amount of a Livener for subcutaneous injection, 0.1 ml. So read again, now that we are done, read again the label of the medication and place it to the medicine tray. Okay, so this is the vitamin K for intramuscular, sterile water for intradermal, 0.1 ml. Okay, now that we're done preparing the two medication, I'm going to withdraw again the Livener for subcutaneous. So subcutaneous, and then just going to open this one, get the injection, open like this one, so it is open. So I'm going to do the bevel up, then down, then I'm going to withdraw again like in the inverted vial, 0.1 ml. Okay, so just going to get this one and then recap it to avoid pricking your needle. Then I'm going to lock. Now I'm going to put it with the name. So read again the medication and then put it to the preparation tray. So this is the Livener for subcutaneous injection. Now that we are done preparing all the medication, we're going to clean our place. Okay. Okay. So now that we are done in preparing all the medication, let us now proceed in administering to the patient. Okay, so since it is not necessary for us to have a true patient, I'm just going to use a vegetables like eggplant and this kamatis. So I'm just going to proceed for the administering of the medication. Okay, so I'm just going to move this. Now I'm going to do the intradermal administration. So after preparing the medication, I'm going to proceed to the patient's room, introduce myself, and verify the client's identity. So to make sure that we give the medication to the right patient. So then explain the medication and what is it for and provide client privacy. Okay? Good morning, ma'am. I am Pia Guenic-Holoculus.
Morning.
Okay, so for today, I'm going to do an intradermal injection to you. So, ma'am, may I see your wristband? And can you please state me your full name and date of birth?
Lady Isaiah Viparine. Date of birth is October 1, 2004. Age is 19.
Okay. So, for today, ma'am, I'm going to do an intradermal injection. So, this was ordered by your physician and Dr. Rivas, and then I'm just going to do this to make sure that you don't have an allergy to the medication. Okay? Okay. So since that we are improvising, I did attach the tomato on my patient's hand. Okay? And now assist the patient in a comfortable sitting position and select the site of injection, and remember to select a site that has no tenderness, swollen, and inflammation, or those that have lesions. Okay, so okay, ma'am, can I see your hand? Okay, so this part has no lesion, so is it okay if I inject this part? Okay, So after that, we have to wear a gloves. But first, we're going to do an hand hygiene. So just going to wear my clean gloves. Okay. Okay, ma'am, for a while, I'm just going to wear the gloves. So how are you, ma'am?
Okay lang.
Okay. So how is your stay here? Sorry.
It's fine. It was
So now that I am done wearing the working gloves or the clean gloves, I'm going to get an alcohol pad and cleanse the side of my patient in a circular motion to reduce the risk of bacteria. Okay, ma'am, I'm just going to clean the area, ma'am, ha? Okay. So there is no signs of lesions in the area, so I'm just going to use that. Okay, ma'am? So just relax, ma'am, and after this, we'll be done. Okay? Okay. Now I'm going, while waiting to dry the injection site, I'm going to remove the needle cup, then remove the air bubbles from the syringe if there is any. Okay? So, again, read the medication before and after withdrawing. So I'm just going to read. So this is the sterile water for Intradermal, 0.1 ml. So, ma'am, I'm just going to inject na, ha? Expose. Ma'am, nag-inject na po, ha? Relax lang, ma'am. So, 10 to 15 degrees angle. And ma'am, just relax. Inhale, exhale lang. Okay. Okay, thank you, ma'am. So, get na naka ni ma'am, ha? Dispose the needle into the sharp container. And then, so there's a, I'm going to encircle it. Ma'am, mag-encircle ko, ha? And then, note the time of injection. Okay. 6:15. Okay. 6:15 p.m. Okay. Now I'm going to ma'am, okay, do not massage the area, ha, because it will swollen. So we'll just wait for the 30 minutes, and then if there is no sign of if the thing that I injected you will not go back to its normal in 30 minutes, means that you have no allergic reaction. You have no allergy on the medication. Okay. Okay. So now I'm going to proceed. So since I'm just going to do the continuation, I'm not going to remove my gloves. Okay. So then document all the procedure done. So okay. Just going to okay, so after 30 minutes we need to evaluate the sites of condition again, if there are any redness and induration, and if there are any and if there are any. Okay, so document it. So let's assume that 30 minutes have passed, so we need to evaluate the site. Okay, ma'am, so 30 minutes have passed. I'm going to check for this site. Okay. So far, ma'am, wala man kay ma'am, allergy, ma'am. Okay. Thank you so much, ma'am, ha? Okay. And now I'm going to do the aftercare of the equipment. Proceeding to the next, okay, now I'm going to perform the subcutaneous medication injection. So since I have done preparing the medication, I'm going to proceed for the subcutaneous injection. So, ma'am, I'm going to position you, ma'am, ha? Okay, so just, so I'm just going to put this to my patient's back so that it will be slightly, okay, ma'am, so I'm just going to, okay, so by using this eggplant, I'm going to attach this to the hypochondriac region of my patient. So, as if, so ma'am, can you please hold this one? Now, I'm going to select a site that are free from lesions, inflammations, and tenderness because this could hinder the absorption of the medication and increase the discomfort at the injection site. So, I'm going to inject on the abdomen of my patient. Okay? Okay, so again, I'm going to perform hand hygiene and apply gloves. So I am done doing it. I'm going to clean now this side. Okay, so I'm going to inject here in your area, ma'am, ha? I'm going to inject here in your area, ma'am, ha, since there are no signs of lesions, okay? So, in a circular manner. Okay. So, I'm just going to, get the medication for subcutaneous injection and read the MAR. Okay. So, this medication is Livener for subcutaneous 0.1 ml. Okay, so, ma'am, mag-inject na ko sa imo ha, ma'am, ha? Relax lang, ma'am. So, again, ma'am, this was ordered by your physician, ma'am, and to have your insulin, okay? Sige. Go by opening like this. Dispose to the sharp container. Ma'am, mag-inject na ko, ma'am, ha? Okay. So, by using 45-degree. Okay, ma'am, mag-inject na ko, ma'am, ha? Then dispose this to the sharp container. Okay, ma'am, thank you so much, ma'am. You can now do the aftercare. So, proceeding to the next. Again, document the thing that you, the administration of the medication. So, I've injected Livener for subcutaneous 0.1 ml on 6:35 p.m. Now I'm going to perform the intramuscular medication. So after preparing the medication, I'm going to again head over to my patient and then introduce myself and then explain why that medication is needed for her. Okay. So, ma'am, Dr. Rivas has ordered vitamin K for intramuscular. So this is a vitamins for you so that you will feel better for the next incoming days. Okay? Just going to go here in my part. So I have other cameras, so I'll just show it to you. Okay. So again, check the doctor's order and the MAR. Check the doctor's order and the MAR. Okay. So, ma'am, mag-inject na ko sa imong ano, ma'am, ha? Intramuscular, ma'am, sa imong deltoid. So, by opening this one. Dispose. And then, do a TART method. So, and do a Z-track method. Okay. So, I'm just going to do a Z-track method by doing like this. And then, ma'am, mag-inject na ko, ha? 0.5 ml, then 90 degrees. Okay, ma'am, mag-inject na ko, ma'am. Okay, so aspirate it. Then, inject. Then inject. Okay. Now I'm going to get this naman, ha. Then dispose. And then get a band-aid. Okay? So, just going to ma'am, mag-put na ko band-aid, ma'am, ha? So, we have to, again, remember to put a band-aid so that it will stop the bleeding of the injection site of the patient. So, remember to put also on the subcutaneous area, okay? Okay. So, after that, make the patient comfortable. Okay, ma'am, so we are done na po. Okay lang pa, ma'am?
Okay lang.
Okay, so relax lang, ma'am, ha? And if you feel any dizziness, just don't forget to inform us. And if you have any relatives here, he or she can go to the nursing station, okay? Okay. So then, thank you so much, ma'am. Now I'm going to remove and discard the gloves and perform hand hygiene and do aftercare of the equipment. Okay? So, and after that, document all relevant information of the procedure done. So that we're going to have a we really need to document all the things that we did so that if our physician wanted a proof, we have the proof to show to the physician. Okay? So, and put this onto the proper receptacle. So that would be all of my parenteral return demonstration, and I have here the documentation. So I've injected my patient with vitamin K for intramuscular 0.5 ml at 7 p.m. Also, I have here the Livener for subcutaneous injection 0.1 ml at 6:35 p.m. And then I have here the sterile water for intradermal injection 0.1 ml taken by 6:15 p.m. So that is all for my return demonstration. Thank you so much for watching, and God bless us all.